Hi, everyone, and welcome to this presentation about communication skills for physicians. You know that effective communication is essential for any human to human interaction, but most importantly, for doctor patient relationship. So let's jump into this presentation and provide further detail. So, why do communication skills have that importance in patient care? Well, because effective communication is essential for providing high quality patient care. It's the foundation of the doctor patient relationship, and it's crucial for accurate diagnosis and treatment plans, as we definitely need to communicate with the patient to take history from them, to examine them, and to explain everything in their managed plan. So it's really important to communicate. Moreover, good communication fosters trust and builds respect between patients and their providers, and most probably lead to better compliance with instructions and better health outcome eventually. So the ultimate end result of good communication between physicians and patient is improvement of the patient satisfaction and overall well-being. That's why we do care about communication with patients. So let's talk about the key communication skills needed by physicians. First off, paying full attention to the patient while they are talking and understanding the patient's perspective is the very starting point in the communication process, just active listening. Some of the techniques that helps in active listening are maintaining eye-to-eye contact. And this is one of the important ones because in the tech era that we live in right now, most of the health systems use computers for note taking. And unfortunately, you will find the doctor focusing on the screen and just listening with their ears to the patient, trying to catch up all the details and write the notes. Well, that is the first detachment between patient and physicians because eye to eye contact is the ABC of communication with anyone, even in your social relation. If somebody is talking to you, your child, your friend, your parents, you need to just give them that eye to eye contact to give them the feeling that you care about what they are saying. The same for patient. Eye to eye contact is number one technique for active listening and productive communication with patient. While doing that, you can use verbal and non-verbal gesture, like without talking, just while listening, nodding your head or leaning forward, showing your attention and care. That also play a good role in active communication with patient. After that, after the patient finish their complaints or whatever they are saying, try to give brief summarization to make sure that you get the information right and to reassure the patient that every concern they have is taken care of. Summarizing and briefing their main concern or complaint is a tool to build that communication between you and the patient and to give them the confidence on you. Okay, so what else? We need empathy. We need to show our empathy to the patients because the patient come to the doctor when they are in a weak position, sick, devastated by the illness, or have a lot of questions. They don't know what is going on. So showing empathy and compassion is very important to build that connection with you and the patient. And that will help later on in the management plan to help them listen to what you are saying as well. So empathy is one of the important techniques in the communication skills. Then we have to be clear and concise in all what we say to our patient. We have to provide the information in a simple and clear and concise way so that the patient can understand and digest what we say. Try to use plain language, avoid medical jargons or very sophisticated language that the patient might not understand. Be as simple as possible. Then explain the complex information in a way that you make sure the patient understand what is required from them and what they have to do and not to do. So clarity is also a key. I mentioned the nonverbal communication, by which I mean the body language, the facial expression according to the situation, and the tone of your voice also count. everything in this communication techniques counts and pay off in patient-doctor relationship. But remember, while doing all of that, you still have to maintain the appropriate and professional distance between you and the patient. While you are leaning to the patient, while you are getting closer, try to maintain that safe and appropriate distance, in spite of you are showing empathy and you are taking care of the patient. Another important aspect in communication is considering the cultural differences. Most of the physicians during this time practice in area where diversity is an issue. You need to have that social intelligence in communication with different people with different background and different cultural sensitive issues. You need to educate yourself about the community that you serve, understand their traditions and customs, what they do, what they don't do, what do they accept, what is not acceptable, and all of that, to have that healthy and good communication with your patients. So communication with patient is not always easy, and sometimes you will face some challenges like language barriers, like cultural differences that we had been talking about. Time constraint is a big issue. It's always an issue wherever your practice is, because at the time that we are in right now, always there are shortages in staff. Always we are working with the maximum capacity, right? So time constraint is a big issue in communication with patient. And we need to be very mindful to budget our time in a way that we don't transfer the sense of being in a rush to our patients and at the same time have a good time management. Usually there is time for each visit. We have to build that time management in our minds first and to make it smoothly happening, like not to cut off the patient and not to go further and deliberate and elaborate in your speech. You have to have that balance between time management and at the same time controlling the conversation and providing the patient with the active listening that they need from you and giving back the information they need to understand and digest from you as their caring physician. So time management during communication is a big issue. We have to consider it all the time. The challenge that most of the physicians face is dealing with anxious patient, anger patient, fearful patient. That requires great understanding and empathy and being professional, trying to avoid taking things personally, in spite of some patients being aggressive, anxious, mad at you at some times. Just remember all the time to deal professionally with the situation and not to take it hard on yourself. All right? And also, a challenging situation is delivering bad news or having difficult conversation whenever there is a sad scenario or situation. This is also one of the tough challenges during doctor-patient communication. We have to be mindful, and there is protocols for those conversations. Maybe at some point we might consider a presentation about delivering bad news and all of that, but you have to think about it as one of the challenging time during doctor-patient communication. So all of that make communication skills very crucial and very important to consider by each physician and to make sure that we are nailing the skills that we need for that. So they found that most of the medical legal issues start from bad communication. So by having good communication, you avoid a lot of troubles and you prevent many medical legal cases that might happen just because at the moment the provider wasn't communicating as well as they should. So that's another important aspect I wanted to highlight, the relation between good communication skills and medical legal issues, which is a lot in the field. So how to improve? How to improve our communication skills? Well, the first step in the improvement is self-reflection and self-awareness. We need to assess our communication skills regularly. We need to identify our weaknesses and our areas of improvement and never hesitate to seek feedback from patients, colleagues, supervisors, whoever around us. We need to be humble enough to take that feedback and to continuously improve. The other aspect is the continuous education by participating in the workshops, seminars, conferences about communication skills. And as usual, learning is an unstoppable process. We always learn. So stay updated in the best practice in patient communication, and that's all what you need. So now let's talk about a different aspect in communication, which is communication with colleagues. And it's not less important than communication with patients, right? Because medical practice and medical care is a teamwork, and no one work in a silo. It's a teamwork. You need effective communication with the team member, whether they are physicians, whether they are paramedics, anyone in the team, whether they are administrative colleagues. It's also important to have that communication skills to deal with all of these personnel around you. You need regular communication with your physician. A critical time is a handoff time when you handle the cases to the next coming colleague, and that's a very important part of the patient care, right? So try to be as clear and concise and professional as possible, providing all the information, what have been done, what is due, and try not to be in a rush. Everyone is ready to go by the end of their shift, but still, the patient care is a continuous process, and that time of handoff is critical time because missing one single information that might not be recorded somewhere or mentioned somewhere is one of the situation that might lead to a big dilemma. You don't need it. The health organization doesn't need it, and the patient, of course, doesn't need it. You need to be very careful in handling the handoff process with your colleagues. So that's all what I wanted to share in this topic of communication. And thank you for taking the time listening to this presentation, and see you in my next presentation. Thank you.